Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Well, we've just started, Reena. How are you doing?
Yeah, good. How are you?
I'm really well. Well, thanks for coming on today. I know you're a busy lass, and you've been in the Middle East recently. How was your experience of delivering the workshops in the Middle East?
Yeah, so I was out there delivering the Mindful Medics program that I run at a hospital for doctors and nurses and administration staff out there in a private hospital. And it's interesting because up until now, the bulk of my experience in healthcare has been NHS. Mainly, and so I wasn't quite sure how it would be taken in the Middle East, talking about mindfulness and empathy and compassion and self-compassion, looking after yourself as a healthcare professional. But honestly, what I realized was that regardless of where you come from, or the institution in which you're working, private or public, we're all prone to struggling, actually, while we look after our patients, struggling to look after ourselves. And the doctors and the nurses and the staff out there were really interested in their own personal well-being and looking after themselves using these practices to better help their patients. So, that foundation, I deliver courses with the tagline, healthcare starts with self-care. And really, I think more and more health professionals around the world are beginning to notice that, if you break the foundation, which is, the staff, then it's going to have a detrimental effect going forward. So had some great feedback from there and hope to be back there soon.
What inspired you to have that tagline?
What inspired me was my personal journey and personal story. So was working in the NHS as a junior doctor, climbing my way up this career path. Though when I left clinical medicine, I left as a GP registrar. Actually, the bulk of my clinical career was in hospital, and particularly in acute medicine and A&E. So of course, was working, crazy hours, as most doctors do, these 12-hour shifts, which never finish at 12 hours, seeing patients. And whilst I enjoyed doing that, I really struggled with my sleep, with my diet. If you're not stopping to eat at regular intervals, you're reaching for sugary foods just to keep going, the odd biscuit on the ward, or the can of Coke just to keep going, or hyper caffeinating yourself as I did many a days. This is going to have an impact on how you feel mentally and physically. And for me, I burnt out, and what was really enlightening for me after the whole process was when I looked back at what was happening and my journey over the past few years working in hospitals. I was burning out, but I wasn't realizing I was burning out. Now, as doctors, we are trained, right, to spot the signs and the symptoms and diagnose. And I had a personal blind spot to my own symptoms of burnout. I'm not sleeping so well. My mood is more erratic, lower in mood. I'm generally an extrovert. I'd started to withdraw. I was focused very much on sort of fear of failing and fear of failing my exams, or just not being good enough, getting all this research and audits and publications out, etc. And stuck in this competitive environment where I look back now and think these are the signs, these are the signs where you're starting to fatigue mentally, physically, where you're losing your mojo, so to speak, and, losing your passion for what you're doing and becoming more apathetic. And of course, I look back now and I could have probably picked this up in someone else external to me, but there was a personal blind spot. And so I think a lot of doctors, nurses, healthcare professionals have this, where they're so focused externally. And of course, we should be. We're there to look after our patients. But if we're not feeling well in ourselves, then this is going to have a detrimental effect. So healthcare starts with self-care, really started from my personal journey where I became very unwell, had to take some time out, was forced by my mind and my body to just stop, and was diagnosed with workplace-related stress, with anxiety, depression, and burnout. And for me, a lot of this, of course, manifested mentally, but physically as well. So I remember there was a period of 6 months where I was really struggling with a lot of sort of gastrointestinal problems, digestion, hyperacidity, not really digesting my food so well. And of course, we know there's a huge connection between the gut and the mind, right? But it's rarely talked about in medical school, the impact that stress has on the body. So I was feeling all of this stuff, but of course, looking for a sort of physical problem rather than considering my lifestyle. So looking for, have I got gastroenteritis or have I got a viral infection or something, rather than actually, is it your lifestyle, Reena, that's causing these issues, and the stress that you're taking on.
And so what made you make that mind shift from external to internal, from viruses to the mind and the internal work?
Yeah. So actually, well, I had to take some time off, and I was initially signed off for 2 weeks, and of course 2 weeks probably not enough to start dealing with the internal storms that are often self-created, the crazy mental mind, the mental monkey mind. So 2 weeks turned into 2 years.
Wow.
And actually I was now long-term off sick, and when you're off sick you lose your identity, right? So most people, it's very interesting, you start to notice things which really get to you. And one of the things that got to me when I was off sick was when I met people, especially new people, there are 2 questions they would ask. Like, firstly, hi, how are you? Who are you? And then the second question is, what do you do? Right? And so the what do I do was a really difficult answer, a difficult question to answer, because it was like, well, I'm a doctor, but currently not practicing. I'm off sick. Like, what do I say? And what will this mean? And how will this person view me? And so I began to get very uncomfortable with that question. And so I realized that I wanted to address why I was so uncomfortable with saying, I'm at the moment, I'm currently not working, and it's because I was very comfortable hiding behind the identity of a doctor. And it's interesting because I wasn't born a doctor, right? I developed this identity, 6 years, in medical school. And then, a few years later, I had this identity, I had this label. And now I was so attached to it. And so that became really interesting for me. I was looking at all of the things that I was so attached to, and they're all kind of these external. I'm a doctor, I live in this particular place, I have this degree, I have a certain status, I have a certain car, a certain pair of shoes, handbags, etc. And actually in these 2 years I didn't have any of that, and I used to spend my days sitting on a park bench, people watching or meditating. I remember watching the swans go by. I was living in Cambridge at the time, sitting by the river, just watching the swans go by and breathing. And that was my reality at that time. And to accept that means dropping all of the I should be doing this and I should be doing that and I should be life should be this way and that way. And that's when really the internal work started. But of
have
course,
you done internal work before? Were you a sort of an internal metaphysical esoteric individual before?
Not to this extent, but yes, I was always quite reflective. I grew up sort of going to the temple and sort of praying. But again, even those prayers were all external, pray for good results in your exams, or pray for, I don't know, the health of your family, or pray for safety, or, but it wasn't like a sort of just pray to be at peace with yourself.
Praying for that internal struggle that people don't realize that they have on a daily basis.
Yes.
There is an internal struggle there.
Pray to navigate the world as it comes to you. And it's not really, for me, it's no longer about prayer. It's just about sort of knowing, having self-awareness of what's happening internally now in terms of my thoughts. So, I'll catch myself thinking crazy thoughts, as most of us have. So it might be, something new comes up for me and the first thought is, I'm going to fail at this. Or actually, I don't know if I'm good enough. Or imposter syndrome, which I had huge difficulty with imposter syndrome, and I still do, if I'm honest. And whenever there's an ask of me, the immediate reaction mentally is, I probably can't do that, or what if I don't do it so well, And so now it's around self-awareness and then self-management of how do you best manage that, and how do you fail forward if you are going to fail. And most of the time we don't fail. It's the fear of failure, because you can always learn, from...
So having watched swans in Cambridge for nearly 2 years, what sort of happened after that?
Well, it wasn't quite 2 years. It was probably a few months on and off. What happened was, during that time, I decided to go back to roots, go to India, and I wanted to look into more holistic medicine. So I decided to study, and really the study was for self-study rather than to practice or to treat anyone else, was to study Ayurvedic medicine, which is, the ancient Indian medicine. And in Ayurveda, they treat you looking at body composition, but they also treat you with meditation, yoga, massage, herbs, diet. So all the holistic stuff. And I started to practice Ayurvedic medicine for myself personally, and this started to help. But what really started to what created the pivotal shift was my meditation practice. So starting to meditate using breath work or body work, body scan, for example, noticing sensations occurring within the body and noticing the change, and everything that happens within the body. Actually, we can reflect externally as well, so things arise, right? So there'll be a sensation that arises, it stays for a while, and then it passes. And that happens with everything inside my mind, inside my body, externally. We are, as they say, a man watching the river is never watching the same river, so that flow of life is always there. And to remain equanimous, to remain stable, despite the storm, so to speak, and enjoy sometimes even the storms, as you're going through them. It was really pivotal for me because I started to notice that I wasn't, I wasn't the identity. I wasn't the status. I wasn't the bank balance. I was this being who was navigating the experience of the world. And so that for me was a huge shift. So it was the meditation practice.
Mm-hmm. And now you do a lot of, let's say, creative work.
Yeah.
Were you always a creative individual, or was it, you identified yourself with the status and the labels that made you forget about your natural creative abilities?
It's interesting you say that because, or you ask that because I never considered myself a creative individual. I was always terrible at art. I can't draw to save my life, for example. Never did really well at music. At school, let's say. Drama, though, I really enjoyed. A bit of a drama queen, so really enjoyed that. But I remember, so it's an interesting story. So growing up in an Indian family, Asians generally, and I am generalizing here, but, place a lot of emphasis on education, and it's the science and the maths, right? In particular. And I remember when I was doing my GCSEs, I said to my parents, look, I'm happy to do the science and the maths. And yes, I'm good at it, but I really want to do drama for GCSEs. And they were like, why? Like, it's such a waste, of your one subject. Like, why don't you choose another language or something? And I said, no, I really want to do drama. And so, they were like, okay, fine, just kind of do your drama thing, but focus on the real stuff, which is the maths and the English and the and the science. And so I did drama, for GCSE. It's interesting because I came out with the lowest grade I came out with was in drama. Interestingly, so I got 8 A stars and 1 A, and the A was in drama.
Wow.
Okay, now you can imagine my parents were like, "See, we told you so." Like, you could have got all A stars across the board, and that's what my sister got. So I was really like kind of competing with the best in my family, and I look back now, and while I did get an A, which is not a bad grade by any means, but the lowest grade of everything, all the other subjects, I enjoyed it the most. And that's the difference, right? Is like, well, actually, we're looking at these external labels and grades, but we're not looking at what gets me fired up. What do I enjoy? What makes me passionate? What keeps me in flow? Like that sort of sense of time just goes and I'm not realizing it, and I'm enjoying what I'm doing, and I'm so focused and so present to what I'm doing. So it's interesting. I never considered myself a creative person, but now, yes, I create workshops, I create courses, I go into various workplaces, corporate world. So I was recently presenting at Google, for example, and I was delivering a workshop around mindfulness and stress and resilience. And a lot of that was creative work that I've put together using my own personal journey, but also looking at the science, but considering how can we take the research and perhaps create an animation to talk about the research, rather than taking people who aren't necessarily interested in, scientific studies as such, like going into the detail, talk to them about the science and the theory of mindfulness meditation using animation, for example. So, really get to do some creative work now and really enjoy it. And that's what makes all the difference for me.
So that's really interesting, because you've alluded to a very important concept, which is enjoying one's work.
Yes.
And there's many people out there who don't enjoy what they do, unfortunately. So what are your 3 top tips for someone who's doing work which they used to enjoy but don't enjoy anymore, how can they get that enjoyment back?
Mm-hmm. So, interestingly, right, you might be in a job which have to do maybe a lot of stuff you don't like. So I personally don't like doing admin.
Yeah.
I don't like doing tax returns, etc. Right? But it has to be done. All right. So what I would say is, when you are doing so, firstly, notice the stuff that gets you really fired up and see if you can do more of that. So for clinicians, there are some clinicians who love doing patient facing work, right? There are other clinicians who really like piecing the puzzle together, and it's the diagnosis or the differential diagnosis and the investigative stuff, for example. There are others who really like, I don't know, the management side of things. So really understand what gets you fired up. Scale it if you need to scale it, on a 1 to 10. Like, this makes me feel like a 10, this makes me feel like a 9. But what the study shows, so interestingly, there was a study done at Harvard which showed that on average the mind is wandering 47% of the time. So almost half of the time we're at work or even at home, the mind wanders and it's distracted. It also showed that the more the mind wanders, the less happy we are. Okay, so even if you're going through a challenging situation or you're doing work that you don't particularly enjoy, see if for a few moments you can apply yourself to focus on it without the distraction. And most people start to feel like once they're able to do that, they begin to start to enjoy it, even if it's a bit mundane. So I would say, firstly, have the self-awareness of what is it that I really enjoy doing and how can I do more of this. But also, while you're doing stuff that you don't particularly enjoy, see if, rather than getting more and more distracted, which takes you away from enjoying the task or takes you away from focusing on the task, you can actually, for 5 or 10 minutes, just focus on the task at hand. You're probably going to be more productive and you'll get that stuff done and out of the way. But most people find that the more focused they are, the more in flow they are, the more they enjoy what they're doing. So I would say those are the two main things. And the third is enjoy stuff outside of work, right? Like, really have, so if yes, we can't all necessarily leave our jobs, and I'm not advocating that we all do that, because it's hard. While now I am in a job that I love, it was hard getting to this point. And, there's always instability and insecurity in whatever you do, which is why I say also enjoy your downtime and time outside of work. So really, if you don't have a hobby or a passion, try out new things and see what really makes you come alive. So I've recently discovered that my thing outside of work is dancing. I love to dance, right? I'm not very good at it necessarily, and I'm not very coordinated, but even if it's just freestyle dancing, I love doing that. And so, if I'm in the car, well, I've usually got a concert going on in the background, my own little rock concert going on. And I really enjoy that.
Wow, that's absolutely great. Coming back to the process of focus, I know you
Yes.
like to talk forever, so we do have only 3 minutes left. Coming back to focus, you've recently been on a silence or a silent retreat.
Yeah.
So do you think that could help?
Of course. I mean, so I recently came back from Vipassana, which is like a 10-day silent meditation retreat. And, I would say it's not something, if you've never meditated before, please don't put yourself through a 10-day silent meditation retreat, because, it's challenging. It was probably the hardest thing I've ever done, yet potentially the most transformative, because you really are left to your own devices, and you really get to know the changing nature of the mind. You get to notice the changing nature of the sensations within the body, and you're focusing the whole time on what's happening internally. And yes, I do feel that it can help, but you don't need to go through a 10-day silent meditation, to help yourself on a day-to-day basis. If you're simply focusing on the breath, the inhalation, the exhalation, the breath entering the body, leaving the body, you can do this in stealth mode, right? So you can do this between patients. You can do this between meetings. You can do this, as you're segueing through the day. And it's a really great way to reset and refocus rather than going into a meeting being distracted from the conversation you've just had, is to kind of reset yourself so that you're better equipped to navigate that meeting and you're fully there.
And that's such a powerful way of, as you said, resetting yourself and increasing your success rate in the next meeting or workshop or patient or relationship or interaction. It's so powerful. How can people get hold of you? What's the best way?
The best way is probably my website, drreenakotecha.com, or email me on mindfulmedics, mindfulmedics @outlook.com.
And obviously you're on LinkedIn as well.
Yes.
Thank you so much. It's been a great pleasure.
Thank you, my friend.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter @The Third Eye Doc and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeyedoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.